Hey, so I've got a little laryngitis, but we're actually going to talk about sinusitis. So if you feel like you have a sinus infection, you probably think you need to reach for the antibiotics, right? Wrong. So that's been kind of conventional wisdom in the past, but it's not correct. So let's talk about sinus infections, what causes them, and then how to accurately treat them. So here's the thing. The term sinus infection has become somewhat of a catch-all term for anything that causes inflammation in your nose. Now that can be viral infections, bacterial infections, or sometimes even just bad allergies. When you get any of these, your body mounts this reactive response trying to fight it off. It causes inflammation in the nasal cavity as well as the sinuses, and it causes mucus to back up, and then you'll get the typical symptoms. That's the congestion, the facial pressure, the postnasal drainage, sometimes the thick anterior drainage, and occasional headache. So same symptoms, but very different potential causes. So it can be confusing. So what does the data show? Truth is, most sinus infections are caused by viruses. Studies show that over 90% are caused by viruses, not bacteria. Now, antibiotics kill bacteria, but they don't do anything to viruses, nothing. So anytime you're taking antibiotics unnecessarily, you're selecting for more resistant bacteria to stay in your body. So then when you do need antibiotics in the future, maybe with a true bacterial infection, they may not work as well. Okay, so we've established that it's probably viral. What do you do? Kind of four things that are recommended. First is decongestants. That can be Sudafed orally or the topical Afrin decongestant nasal spray. Really helps shrink the linings, helps keep things flowing. You really feel good on it. You just need to limit it to maybe 2 or 3 days. Second are saline rinses or sprays. Help get the mucus out of your nose, get the snot out, help clean the surface as well. Number 3 are the topical nasal steroid sprays. That's the Flonase, the Nasonex, the Nasacort, the Rhinocort. Studies show that they do help decrease inflammation in those acute infections and can help you feel better as well. And then the fourth thing is rest. Obviously, take it easy, let your body recover. Most often, things will start improving within 5 to 7 days and then continue to resolve fully shortly after that. Okay, so we've established that over 90% are viral, but it still might be bacterial, right? Yes. Red flags for maybe a bacterial infection: if you still have the same symptoms or are worsening, it's been 7 to 10 days, or if you had the double sickening, meaning that you were sick, got kind of better, and then you're sick again, that could be a sign of a bacterial problem. And other things, maybe a high fever, 102, or if you're immunosuppressed in any way, say you've got diabetes or on medications to suppress your immune system, obviously that puts you at a higher risk for a bacterial infection. It would be wise to seek care from your primary doc, Instacare, or your ENT. So next time you have a sinus infection, go with statistics. It's probably viral. So don't reach for the antibiotics unless you try the more conservative measures for at least 7 to 10 days.